Hello and welcome to the WIHS Journal, Public Affairs from 104.9 FM. I'm Paul Kretschmer. This is the second of 2 days of conversation with Dr. Lynette Charity, a doctor of over 35 years practice, who's talking to us about the coronavirus and how to respond to it in a healthy manner. As we rejoin the conversation, she has just told me that doing something to raise her spirits, like an interview, is helpful to her. I was going to ask you if going to a location and taking food out is safer than having someone deliver it. And the reason why I ask is because I live in an apartment complex, and it's not at all unusual, in fact, quite usual, to see any number of takeout places, or delivery places, I should say, come into the property and stop. And I've seen people hand food containers to people at the door rather than put them down on the ground. And I guess what I want to know from you is, do you think that the people who handle that sort of thing from the restaurant end are well informed enough or scrupulous enough to enforce that kind of rule with their delivery people so that they don't inadvertently make people sick?
Well, everyone has their own rules. The one company that I can say that I've noticed lately that really has it for an art form for doing it where you actually go through their drive-through is the company Chick-fil-A. I don't know if you know that.
Oh, yeah, we have them here. Yep.
Okay. They have it down to a science. I was true because sometimes I have to have my Chick-fil-A. I just have a Jones for Chick-fil-A, and I wasn't sure how to do it. But I drove through just the other day, and they had their workers obviously outside because they're not allowing anyone inside. But outside, you drive through. They have stationed, about 6 feet apart, their workers who are wearing gloves, who also have their the menu encased in plastic. You're not allowed to touch it. What they do is you roll down your window and then you can read it. I always know what I want. Mm-hmm. But then they will not take cash. You have to use a credit card or a debit card. They have a swipe. They have a machine that they hold up to you. You personally swipe your card. It takes it all. When you pick up your food, it is in a brown paper bag. It is handed to you by someone wearing gloves. And when you go through, the person that's handing you the food is wearing gloves. I personally wear gloves when I go out. And being a physician, I've always had an N95 mask. So when I go out, I do wear my mask just in case, because there are a lot of young people out there. And some of these young people don't realize that they think that they can just congregate because it's not going to affect them. What they don't understand is it may not affect you, but it could affect your parents or your grandparents. And so the important thing is that we get them to understand this is necessary also, so they don't give me COVID while I'm out there. But I do wear my mask when I go out, and I wear my gloves. But to answer your question, even if they're not being taught that, the person who is receiving it should tell them, put it down on the ground, I will pick it up. Or, put it, they can give that to them saying, I will not be out there, it's paid for, just I will pick it up after you leave. And then they pick it up after the person has left, and then they follow the routine. And hopefully, if they don't have gloves, that they will have something else to pick it up with. But they need to get it out of the box. COVID does not seem to be on food, and I think it's because food is cooked, and that's why we're not seeing any cases of it being transferred by food. As I said before, it is because of these respiratory droplets, people sneezing, coughing into their hands, then maybe touching something, then someone else touches it, and so on and so on. That is how it's being transmitted. So for you in your apartment complex ordering takeout, just follow that, and you should be fine.
What is your concern about medical professionals who are working so hard right now? I was listening to a report from the BBC World Service on my way to work today, and a doctor from New York unnamed but identified as a physician in a New York City hospital, spoke about feeling exhausted all the time, running all the time, wearing protective gear which makes her sweat through her scrubs and so on. And I would think that after just a short amount of time, the overwhelming stress of dealing with all of the dangerous stuff as well as the physical stress of working in a situation like this would be pretty close to bringing someone to burnout if they don't have a way to relieve or cope with that.
Well, obviously physicians have been suffering from burnout for quite some time, and this has just added fuel to the fire. Once this has run its course, it will be necessary for all of these physicians that have been on the front lines, physicians and other healthcare workers, all of them will need to have some mental health time. And, to be honest with you, that will definitely impact upon the healthcare environment, which was already strained to start with.
Mm-hmm.
But these people, if they are to survive after COVID, they are going to need some time off. They're going to need truly, and I mean not just take a couple of days off and then come back to work. They will need to have a paid vacation by someone who's going to pay for them, where they can go and lie on a beach. I wouldn't recommend a cruise, but lie on a beach or just go away to the mountains, go somewhere, something that they really want to do, and take time to heal. I feel guilty because I am a physician, but when they were asking if people could volunteer to come in and help, I had to really dig down deep and decide whether I wanted to guarantee that I would be here for my grandson to watch him graduate from high school, or throw myself into the thick of things. And my husband is a physician too. We both said we have to figure out a way to help from afar, because we want to be here for our grandchildren, for these people who are on the front lines and who this is their calling. What people don't seem to understand is that we physicians, this was our calling. My calling 40 years ago was I wanted to be a medical doctor. And what made me retire was the fact that I was trying to be a medical doctor, but there were so many things in place that produced burnout in me. And because I suffer with depression, I had a breakdown. I'll be honest. I could not do what I wanted to do, what I truly loved, in the environment that has become healthcare. And it has now been made worse by COVID. So I'm hoping that in the future, when this is done, that people will reassess how they feel about their healthcare providers and understand, as they see them dying in the trenches, that we are human like everybody else, and we suffer just like everyone else, and that we will need time to heal when this is all done. Paul, thank you so much for having me on your radio show. I appreciate it very much. I hope I didn't rant and rave too much.
No. You're very eloquent, Doctor.
Yeah, okay. Well, that's good to know. I appreciate your time.
That concludes my 2-day conversation with Dr. Lynette Charity, talking about how to respond to the coronavirus COVID-19 outbreak. For further information, call us at 860-346-1049. 860-346-1049. The opinions expressed are those of the participants, not necessarily those of the staff or management of this station. I'm Paul Kretschmer on the WIHS Journal, Public Affairs from WIHS, Middletown.